Erectile dysfunction. A possible early heart disease indicator? A natural method to boost nitric oxide without Viagra. Quick summary. Erectile dysfunction, ED, or impotence, isn't solely a hormone problem. It frequently signals vascular or metabolic dysfunction, particularly insulin resistance. This can occur years before potential heart issues arise. Enhancing endothelial function and nitric oxide, NO, through a dedicated lifestyle can improve sexual performance and lower cardiovascular risk simultaneously. 1. Defining erectile dysfunction. Definition. ED is the consistent inability to achieve or maintain an erection adequate for intercourse. Unlike low testosterone, which primarily influences libido, mood, and physical form, ED is usually vascular or neurological in nature. Research indicates ED might serve as an early warning sign of cardiovascular disease, sometimes appearing 2 to 5 years before cardiac symptoms begin, presenting a golden window for early intervention. 2. The vital role of nitric oxide. NO, the endothelium, or vessel lining, produces NO, which promotes vasodilation and increases blood flow to the corpora cavernosa. The availability of NO decreases with age and conditions like diabetes or insulin resistance. Supporting the NO pathway with nitrate-rich plant foods, such as arugula, beets, and consistent exercise is a well-documented strategy in vascular medicine. 3. Where PDE5 inhibitors assist, and where they fall short. Phosphodiesterase type 5, PDE5, inhibitors, like sildenafil, Viagra, inhibit the breakdown of cGMP, extending the NO signal. However, they do not create NO directly. Common side effects include headaches, flushing, low blood pressure, blue-tinted vision, and rare cases of sudden hearing or vision changes, or prolonged erections. These are contraindicated with cardiac nitrates. Thus, enhancing NO production naturally through lifestyle choices is simultaneously a parallel and sometimes primary approach. 4. Underlying causes, often modifiable: insulin resistance, metabolic syndrome, diabetes, hypertension, dyslipidemia, obesity, and smoking. Potentially contributing medications include certain antidepressants, some pain relievers, diuretics, some antihypertensives, antihistamines, and specific prostate or hair loss medications. 5. Natural protocol for supporting the NO pathway. Protocol A. Enhancing NO and AMP. Endothelial function, strong evidence. Nitrate-rich greens, arugula, beets, may elevate NO availability and support blood pressure in select populations. Aerobic exercise, resistance training, and high-intensity interval training, HIIT, short, intense efforts with brief recovery improve insulin resistance and endothelial function, crucial for vascular ED. Cocoa or dark chocolate high in flavanols, approximately equals 85%, enhances flow-mediated dilation and functionally boosts NO levels in studies. Moderation is essential to limit sugar intake. L-citrulline converts to L-arginine and bolsters the NO pathway. A small trial with mild ED showed enhanced erection hardness, but evidence remains limited. Protocol B, botanicals, supplements, limited effects. Korean red ginseng. Multiple studies indicate positive functional improvements. Saffron shows mild effects in small studies. Ashwagandha may reduce cortisol and slightly elevate testosterone, inconclusive regarding ED. Epimedium, horny goatweed, potential in vitro PDE5 inhibition. Limited human evidence, use with caution. Clinical note: be aware of potential drug interactions with blood pressure, glucose, anticoagulants, and avoid unverified sources. Protocol C, supportive strategies, strong evidence, low risk. Pelvic floor, Kegel, exercises. Enhance pelvic control and support erections in many patients. Deep sleep, 7 to 8 hours, quitting smoking, reducing alcohol, and weight loss, contribute to better vascular health and alleviate ED. Slow nasal breathing. Inhaling through the nose supplies no and stimulates the parasympathetic system, offering general vascular benefits, though direct evidence is lacking. Acupuncture. Offers limited but encouraging results, not a primary choice. Cold water exposure, showers, may temporarily stimulate the autonomic nervous system. Lacks strong ED-specific evidence but may aid general recovery if desired. Protocol D, when fibrosis or scarring exists. Low-intensity shockwave therapy, LISWT, experimental and procedural. Not currently recommended as routine by major urology guidelines. 6. Practical steps. A 30-day plan, no therapeutic guarantees. Week 1. Eliminate added sugars, refined flours. Brisk walk for 30 to 40 minutes daily, 5 days a week. Start daily Kegels, log blood pressure and weight. Week 2. Incorporate a nitrate-rich salad twice daily. Arugula, beets, initiate light resistance training, 3 sessions. Week 3. Add moderate HIIT twice weekly if heart healthy. Enjoy a piece of 85% dark chocolate in moderation. Aim for 7 to 8 hours of sleep. Week 4. Evaluate weight, blood pressure, energy, and erection firmness. Consult with your clinician about fasting glucose, HbA1c levels, lipids, thyroid, and testosterone, if necessary. Seek immediate medical attention if you experience chest pain, shortness of breath, fainting spells, painful prolonged erections, starting cardiac nitrates, or sudden ED without an obvious cause. Educational note. This overview is intended for informational purposes only and is not a substitute for professional medical advice. Always consult a qualified healthcare expert before beginning any supplements or altering medications or exercise routines. For more great content, subscribe to the channel, turn on the bell, like the video, and share it far and wide.